Hi, today's topic for the discussion is endodontic diagnosis. So, we all know that endodontic diagnosis is a very important part which is required for managing a particular condition and coming to a proper treatment plan. So, in dentistry, the clinical test is often divided into two types, the objective test and subjective test. Objective test is a portion from where most of the important question in NEET MDS is being asked. So the objective clinical test is of three types, the pulpal test, periodontal test and periapical test. So we know that in our pulp there is two important feature, that is the nerves as well as the vascular flow or the blood flow is there. So the nerve test is otherwise called as the neurosensibility test, and it is of two type, that is the thermal test and the electrical pulp test, and you can memorize it as the number 10. The nerve test is of two type, thermal test and electrical pulp test. And to add on to this, we have an aesthetic test as well as cavity preparation test to this. Next, all the other tests comes under the vascular supply test, like the dual wavelength spectrophotometry, pulp oximetry, laser Doppler flowmetry. The names it pulp oxy means oxygen, so vascular supply. Laser Doppler flowmetry means vascular supply. Transmitted light photoplethysmography, xenon 1,3 radioisotopes, crown surface temperature, ultraviolet light. All the other tests actually indicate the vascular supply. So just memorize these three important nerve tests. Other comes inside the vascular supply test. So next is the periapical test. Periapical test is of three types, that is the percussion test, palpation and also the mobility test is there. Periodontal tests include percussion, probing and mobility. So what do you mean by percussion? As you can see in this image, what we do is like we'll be using a blunt instrument and we'll be hitting on the tooth surface. If the patient is having pain, that means that there is inflammation in the periodontal ligament area. So percussion test indicate that there is an inflammation in the periodontal ligament area, but this test cannot differentiate between a vital and a non-vital tooth. Very important. Now the percussion test is of two type, vertical percussion that you can like up and down motion, and horizontal percussion will be on the buccolingual aspect. And vertical percussion test often indicate that there is a periapical pathology, and when we do a horizontal percussion test, if the patient have pain, that indicate that the periodontium as a whole is having some kind of problem. As you can see in the image, this is vertical percussion test, this is horizontal percussion test. Next is mobility and depressibility. So very important term is like mobility. If the tooth is having mobility, it means that the periodontal ligament which support the tooth is having any problem, some problem, or a compromised periodontal attachment is being actually shown. So as I said earlier, when we hit the tooth, the patient have pain means there is certain receptors called as proprioceptors that is seen in the periodontal area. So when we actually hit the tooth, the patient might have pain because of the proprioceptors that is seen in the periodontal area. When we hit, if just think that the patient is having a pulpal disease, it have just affected here. If we hit, patient might not have pain. That is because this proprioceptors are not seen in the pulpal area, but they are actually seen in the periapical area. See, the spread of pulpal disease in the periodontal space stimulate proprioceptive nerve fibers. So think that if pulpal disease is there, there is no pain in the periapical area because there is no proprioceptors on the pulpal area. There is large amount of proprioceptors that is seen in the periodontal space. That is why when we do any test on the periodontal space like percussion or palpation, there is pain that indicate that there is activation of the propion receptors at the periapical area. Next, very important thing, the classification of mobility. This is often asked for the vivas at the NEET MCQs. It is divided into 1, 2 and 3. First is like there is a slight movement, it indicate that the first classification. Second classification, if there is a horizontal movement of not greater than 1 mm, means that it is a first category. Second category, when it is the third category, it is having a movement more than 1 mm, and there is also vertical motion is also there. This is another important classification, Miller's classification. You can see it is based on the number range of 0.5 mm difference or to 1 mm difference. See, 0, there is no mobility of the tooth. 1 means 0 to 0.5, 2 means 0.5 to 1.5, and it is more than 1.5 means it is actually Miller's grade of mobility classification, right? Very important. Now, depressibility means when we actually push the tooth in a vertical dimension, the tooth will move within the socket, and this often indicate that retaining the tooth is actually very tough, and there is chance of a there is need for extraction. We cannot save the tooth, it is having a poor prognosis. Okay, so that was about the percussion test, mobility and depressibility test. All these tests indicate or actually show the condition of the periodontal space area. Next important is intraoral sinus tract tracing. Sometimes the patient might comes with actually a swelling, and you can see there is a small sinus opening. So what we does is like we'll be actually using a gutta percha cone that is of size 25. That is very important. 25 size gutta percha is actually used for intraoral sinus tract tracing, and we'll be applying the gutta percha through that small stoma or the opening, and we'll actually pass the gutta percha. It will move upward and it will move to the area from where the lesion originated. So this is one method to find out which tooth is having infection, to trace from which tooth the infection have actually started, etc. Next is periodontal examination. In periodontal examination, we'll be using certain periodontal probes, and we'll be actually seeing whether there is any periodontal pocket or periodontal swelling, inflammation, etc. All these are present, it indicate that there is inflammation of the periodontium or the periodontal apparatus. In these conditions, a simple root canal treatment cannot actually resolve the problem, but we need to do a periodontal treatment like either flap reflection, curettage, surgery, etc. So this is very important. When there is a periodontal apparatus problem, we have to do a periodontium related treatment. Alone by an endodontic treatment cannot resolve the periodontal problems. Next is actually the percussion area involvement. The percussion area is actually the area where the two root actually connect. If there is bone loss in this particular area, it often indicates the depth of infection that is spreading in the periodontal space. So see the grade 1. In grade 1, the pocket is often supra-bony. It is actually supra bony, it will be actually supra bony, it won't be seen by your naked eye, and there will be intact bone. There will be only slight pocket seen in grade 1. In grade 2, there is actually destruction of the bone in one or more aspect of the percussion area, and we can only partially penetrate. It will be just moving on a partial basis only. There will be movement of a instrument. Grade 3 is like intraradicular bone losses. That means there will be complete bone loss on the particular area. And grade 4 is that there will be complete loss through motion. Means that the instrument can actually move from one percussion area to the second percussion area. So this is a very important classification, Glickman's classification for the percussion involvement and the periodontal status assessment. Next is a two important term, pulp sensibility test and pulp vascularity test. So what do you mean by pulp sensibility test? Pulp sensibility, as I said earlier, that indicate the sensory response or the nerve response. Very important. These two are often assessed in pulp sensibility test. Next is pulp vascularity test. We know that the blood flow at the vascular supply is being assessed. Next important thing is sensitivity and specificity. Very important terms often we see in question papers. See the term specific. Specific means the ability to test the teeth without disease. that means the tooth is, we will be specific about a thing. That means that the tooth will be vital without any disease. What is sensitivity? Sensitivity is the ability to identify the teeth that are diseased. So this is very important. Sensitivity and specificity. Sensitivity means the diseased condition. Specificity means the non-diseased or the vital condition, right? Next is the test. As I've already explained, we'll go to in explanation in each. So before going into that test, we need to know what is a control tooth. So we'll be doing the test in a control tooth first, then only we will be going to the diseased tooth to say that this tooth is diseased, because a control tooth should act normally in order to indicate that it is healthy, so that we can conclude that the other tooth is actually not vital or unhealthy. So always the contralateral tooth or the and adjacent tooth is actually selected as the uh, control teeth. Contralateral means just the opposite teeth. They says that the refer if the pulp of this side is having a pain, the pain won't be actually traveling to the contralateral area. So always the contralateral teeth and the adjacent teeth should be actually taken as the control teeth. Especially when we do a thermal test and electrical pulp test, the diseased teeth are always examined first, and to rule out bias, the contralateral teeth are actually used as a control teeth. Why I've added this point is like this is one of the question that was asked in NEET MDS PG. So in thermal and electrical pulp test, what we do is that the diseased teeth is examined and also the contralateral teeth is often examined to rule out the problem. Right. Next, see the question. The control teeth used during pulp testing are. The answer is like adjacent and the contralateral teeth. So that is the answer for this question. Right. Now, before going into each test, it is very important to know that what is A delta and C fibers. So when we take the pulp, there are two important fibers, that is A delta fibers and C fibers. A delta fibers, so this will be the pulp. The A delta fibers are actually more above placed on the pulp horns, and also the superficial surface of the pulp A delta fibers are actually C. But inside the core part, you can see C for core, the C fibers are actually morely C. Right. So we need to know what is the difference between A delta and C fibers. You can see in the C and the difference. A delta fiber is mainly seen on the pulp dentine border. That if this is the pulp, this is actually seen in the pulp dentine border. But C fibers are more centrally placed, or in the core it is actually placed. And it is directly connected to the thalamus. The A is connected to actually thalamus. Here the C fibers is actually moves through a interneuron branch, and after that only it actually moves to the thalamus. Very important. And A delta fibers, the A delta fiber are myelinated. Myelinated means myelin sheath will be actually present on the external surface of the nerve. So there will be faster conduction of actually the pain or any stimulus, there will be faster conduction. But in the case of C fibers, it is not myelinated. So there won't be actually a faster conduction. It will have a very slow, dull conduction. Here, it will be fast and sharp and localized, and the pain is directly stimulated to the thalamus. But C fibers, it is very slow, dull pain, and it is often a aching pain and diffuse pain, which is actually slowly conducted through the interneurons to the thalamus area. Right. And A delta fiber often actually stimulate all the pains like the like EPT, the electronic pulpal tester, and heat movement, cold movement, etc. has been actually detected by the A delta. C fibers is, as I said, it is C. C means it is more core placed. Mainly the EPT, when we actually take to a very high stimuli, only can stimulate the C fibers that is internally placed within the core material. Hope you understood. So this is the main difference between A delta and C fibers. A delta is myelinated, so faster conduction. C fibers is actually myelinated, slower conduction. Right. Another important thing is like A delta fibers are stimulated by fluid movement. As I said, you can see in this image, on the here there is dentinal tubules present. Inside that there is dentinal fluid. So the dentinal fluid will move like this. The dentinal fluids will move inside this. So what happens is, like as I said, A delta fibers are actually placed here. So what happens is, like this dentinal fluid often touches the A delta fiber and it activates the A delta fiber. Whereas in EPT, that is the electrical pulp tester, A delta fiber are stimulated directly. In cold and heat test, the expansion of the tubule often activate the A delta fiber. Hope you understood, right? Because in heat test and cold test, we will be applying the stimuli, like heat and cold will be applied on the tooth surface. So what happens, the inside the dentinal tube there is dentinal fluid, it moves and it goes and touch the A delta fiber over here. But in the case of electrical pulp tester, we'll be applying a electricity on the tooth surface. This electricity goes and directly hit the A delta fibers that is seen on the junction between the pulpodentinal complex, right? So that was about A delta and C fiber. It is a very important part that you need to know. Next, coming to the thermal test. Thermal test is of two types, as I said, heat test and cold test. As I said earlier, they detect the nerve system complex. That is, a neural sensibility testing is done by nerve, not the vascular supply. Nothing to deal with the blood flow. So heat test, similar heat carrying devices like electrical heat carriers, hot gattapacha sticks. Gattapacha will be heated and will be applying on the tooth. Water will be, as you can see in this image, the water will be actually applied on the tooth surface, as you can see here. And we'll be using some burrs or burnishers with heat and applied onto the tooth surface, right? After that, so we need to know some of the uh, like temperature at which each material works. See, first is hot gattapacha. How you can memorize this? I used to memorize like gattapacha. G we used to write like this, right? G. So you can convert G to 6. So it is 65.5 degrees C. That is the temperature of hot GP. This question has been commonly used. What is the temperature of a hot GP to activate the A delta fibers that is seen on the pulp? So see, you can memorize like this. G will be writing it as 6. So it is 65.5 degrees C, which is a required temperature for hot gattapacha. Electrical heat carriers, that are certain machines, so it should have a higher temperature, that is 150 degree Fahrenheit. Very important. Hot gattapacha smaller temperature like 65. Heat carrying machines will have 150 degree centigrade. After Fahrenheit. After that, very important, and other components like hot component, we'll be using some polishing burr on the surface of the teeth. It will generate heat. All these are used for assessing the tooth vitality. So what happens when we apply heat to the teeth? Very important, it is very important to see that application should be done only for 5 seconds, not more than 5 seconds. Heat for 5 seconds and cold for 15 seconds. Very important point. And heat action on the tooth is actually explained by Van Hassel's theory. So what happens is, like when we apply heat on the tooth surface, there will be vasodilation. Heat causes vasodilation. As a result, you can see this is the pulp. So when we apply heat on the teeth surface, there will be, this was the pulp earlier, this become the newer pulp, that is a vasodilation take place. So there will be increase in the intrapulpal pressure, there will be increase in the intrapulpal pressure, and as a result of that, they actually activate the C fibers that is seen in within the core. Understood? There will be vasodilation within the core, the C fibers will be activated. So this is the mechanism. Heat, just 5 seconds. Van Hassel's theory, when we apply heat, vasodilation take place. It activates the core material, that is the C fibers. Very important. And next is like where we need to apply the material. You can see in this image, it is always applied in the cervical or the middle third. That is mainly because why it is like that is like less enamel is seen in this area. So we can actually activate the pulp or the pulpal nerves very easily. That is why it is applied in the cervical area or middle third. Very important question. So as I said earlier, when we apply heat for less than 5 seconds, what happens is like vasodilation take place. It activate the C fibers. And important thing is like if the patient have a pain at that time, and when we remove the stimulus, it went away. That means that the pulp is very much healthier, right? If we apply the heat, even though after removal of the stimulus, the patient is feeling that pain, means the pulp is not able to come back to its normal condition. There is a irreversible pulpitis. Pulpitis means inflammation of the pulp. The pulp is not able to come back to its normal position. So that is indicating that there is some diseased pulp called as irreversible pulpitis. When even though we keep the stimuli, the patient is not showing any kind of response, that means that the tooth is actually non-vital. Another important NEET MDS question is like, what is the preferred temperature of heat? That is 65.5 degrees centigrade. So that is a temperature at least which is required to activate the C fibers in order to show the response through heat. So this much was all regarding heat. So while you study heat test, what are the heat test, what are the temperature, what is the time period that we need to keep, vasodilation take place, what are the responses which we see. This is very important thing. Next is cold test. Cold test means we use the common eyes or the endo eyes, pencil of eyes, etc. So how to memorize all these things? See, endo eyes, this is the most commonly used material. You can see this in your clinical practice or the clinics or your college, etc. Endo eyes is most commonly used. How I memorize the formula of endo eyes is like, endo we are coming in contact with a lot of numbers, right? So endo eyes just memorize like the chemical formula have a lot of numbers. So it is like 1112 TFE. TFE. Okay, that is tetrafluoroethane. Very nice, very easy to memorize. Endo eyes means endo we come across a lot of numbers, so it is like 1112 tetrafluoroethane. So what is the temperature? Temperature, as you can memorize, there is 1112, right? So it is connected to 2 minus 26.2 degree C, right? This is the way how I used to memorize such kind of numbers. So cold test, first is endo eyes, there are a lot of numbers, 1112 tetrafluoroethane, 26.6 degree. Next is, there is carbon dioxide snow. Just memorize it, CD. We use CD compact disc in early times, right? CD means carbon dioxide snow is also called as dry ice. Very important. Next, pencil of ice. As you can see in this image, small pencils of ice will be actually used on the tooth surface, and sometimes rubber dam isolation will be done, and to that cold water will be actually pushed to see that patient's tooth is having any sensitivity. Another important thing is ethyl chloride. Very important. That is just minus 4 degree. And another thing is difluoro dichloro. How I memorize like difluoro, see, half half. So it is like minus 50 degree centigrade, right? Half half, dichloro difluoro. So it is half half. So memorize it as half, minus 50 degree centigrade, right? After that, as I said earlier, the most common method which we apply as cold test is like, see, tetrafluoroethane. And cold test is actually used to differentiate between the reversible and irreversible pulpitis. Understood? CD. As I said earlier, the carbon dioxide snow is also called as the dry ice. And the temperature of dry ice is minus 78 degrees centigrade. That is CD. You can memorize it, CD 78. Right. That is the carbon dioxide or the dry ice is having a temperature of minus 78 degrees, and just connect it and study. Right. Why it is, we know that our tooth sometimes consists of a crown or a full coverage restoration most of the case. So what we do is that most important test that can be done in a crowned teeth or a full coverage restoration is actually the carbon dioxide snow test. This is the have the capacity to penetrate deep into the full coverage restoration. So that was the question commonly being repeatedly asked for to your NEET PG examination. Just go through that. Next, what happens when we apply cold? As I said earlier, heat causes vasodilation. Cold causes vasoconstriction. So vasoconstriction, as I said, it activates the A delta fibers that is actually seen on the upper part. just they activate the A delta fibers. Early cases, it actually activated the C fibers. And what happens is like cold should be applied for 15 seconds. Other case, it was 5 seconds. Very important. Again, the same comparison. If pain persists even after we keep cold and we remove that pain still persisting, means our pulp is not healthy, it is not able to gain its normal function again, it leads to irreversible pulpitis. And if the patient, we kept the stimuli, we removed it, patient's pain subsided while we removed the stimulus, that means that it is a reversible pulpitis case. When we place the stimulus, removed it, no response, means it is actually a non-vital tooth. Very important. So there might be some disadvantage when we use such kind of actually pulpal diagnostic methods. So carbon dioxide source, CD, dry ice. So what will be the temperature? Hope you memorize it. It is 78, right? It is like in fraction lines. You can see in this tool there will be small lines that is created called as an infraction line. This is one of the disadvantage of carbon dioxide snow, and that is why we have actually nowadays using difluoromethane, that is 50 degrees centigrade, 50 degree, half. So this is being used nowadays. That is mainly because there is less disadvantage when compared to the carbon dioxide snow. So this is one of the question that was asked for in NEET MDS PG. That is, diagnostic test commonly used to determine the status of vitality of pulpus. Of course, it is the thermal. Vital test is always done with the help of actually a thermal testing. Okay, right. So next method is electrical pulp tester. This is also used for assessing the nerve conduction. What we do is like we'll be using, you can see the instrument that is seen here. It is actually used, we'll be applying a small amount of current that is delivered through the enamel and dentine. And what happens is like this is the pulp, as I said. It consists of A delta fibers. It will directly activate the fibers that is seen on the surface of the pulp, that is A delta fiber. When we actually keep on applying the electrical pulp tester, the current will pass indeed inside it, and it might activate the C fibers that is actually placed on the core. Understood? So this is the main thing about electrical pulp testing. Another three important things that you need to memorize when you study the electrical pulp tester is, first is the electrolyte that is actually used is, first is Nicholas colloidal graphite. Nicholas colloidal graphite is actually used here, and Grossman's toothpaste is used. This too you have to memorize. Now, which is the best position to do a electrical pulp test? That is mainly on the incisal aspect of the incisal two-third of the anterior tooth and middle third of actually the posterior teeth. And why we apply is like the pulp horns in this region are more pronounced, and it will activate the A delta fibers. So hope you understood. Electrical means nerve activation. We'll be using the machine, incisal edge on the anterior tooth, middle third on the posterior tooth. That is because to stimulate the A delta fibers. Very important. Next, two important thing is false positive response and false negative response. What do you mean by false positive response? Means that the tooth is having some necrosis in some part of the tooth, but it shows that it is okay, it is proper. Just think that my anterior tooth is having a necrosis inside the pulp, but when I did the test, it showed a normal response. That is false, showing that it is positive, falsely showing that it is positive. In which two condition? First is gangrenous necrotic pulp. In gangrenous necrotic pulp, there is a fluid, gangrenous substance, which actually conduct the current faster. So what happens is like we might think that it is actually a vital tooth. That is false positive, falsely interpreting that it is having a positive good result. Another is like multiple rooted teeth. Multi-rooted teeth, just think this is actually our upper tooth. Palatal root might be necrotic. So when we, and this will be having pulp. So when we apply the test, electrical pulp tester, it show a normal vital, but actually it have started that necrosis. So this is the two condition where false positive response is seen. Next is false negative, means that falsely showing that the tooth is non-vital. Negative means negative result, non-vital. So the tooth might be alive, but it is showing the tooth is dead. In which all condition? In calcification cases, the tooth is entirely filled with the calcified tissue and there might be some amount of pulp. This is the pulp. It will be completely filled with the calcified tissue. Some area there might be a small amount of actually pulp that is present. But because of this calcification, the electrical current cannot pass, right, and it shows that the tooth is dead. That is false negative. Another important thing that you need to know is recently traumatized teeth also show the tooth is like, because of the shock it have gone through, all the nerves might be actually engaged and it doesn't show any response. Actually the tooth might be alive but it shows as a false negative response. Third is like very important, recently erupted incompletely root formation also show a false negative test. This is very important. And certain medication cases also actually show fibrotic pulp similar to that of calcification also show false. Never get confused. False positive means falsely showing that it is a positive response, live tissue, but it is having certain necrosis. False negative means actually the tooth is alive but it shows that it is dead. In three important conditions that you need to memorize: calcification, traumatized tooth recently also show no response at all. Third is like incompletely formed tooth. See here, electrical pulp test for an immature tooth. Immature means the pulp is not completely formed, but it is alive. It shows as what? It is dead. Means falsely negative response. Falsely negative response. So that was the answer, falsely negative response. Okay. Next, sensitivity, specificity, already we have discussed. Another important thing is like what is the manner in the clinical practice that we need to do a diagnostic procedure. The first is like a combination of two methods is done. First is cold test followed by EPT. This is the recommended method. That is, cold test followed by EPT is very important to bring about a proper result. Cold test followed by EPT. That is mainly because a test was done which showed that accuracy. The question might be like, among the following, which show most accurate diagnostic test? You can see in this image, the cold test show about 86% followed by EPT, that is 81%, then only the heat test. So keep in mind, cold test followed by EPT, EPT followed by heat test. Another important slide that you need to keep in mind is like nerve fibers that respond to electrical pulp tester. Just memorize what was it. Electrical pulp testing activate the A delta fibers. And hydrodynamic event means what? There is cold and hot activation which activate the dentinal fluid. It activate the surface of the, as I said earlier, this is actually the pulp. The pulp surface consists of A delta fiber and inside only there is C fibers. This is the dentinal tubule where the dentinal fluid moves like this. So the dentinal fluid attacks the A delta fiber. That is why it shows the hydrodynamic events, means movement of hydro means what? Hydro, water. That is the dentinal fluid movement activate the A delta fiber. So easy. Electrical pulp test we have already studied. It is A delta fiber. Hypersensitivity test, as I said earlier, cold we apply, there is movement of the dentinal fluid tubule, activate the A delta fiber. Inflammation, different. Inflammation means what? There is a proliferation or there is a necrosis that have taken place inside the pulp. So it often activate the C fibers, very important. That is the only difference. In C fibers, in inflammation, the C fibers are activated, right? This for just knowledge. A fibers and C fibers are commonly there. A beta fibers are there. In our pulp, mainly A delta fibers and C fibers are there. A delta fibers pain, C fibers pain, because our pulp can actually have a perception of only pain, right? A beta fibers is for pressure and touch. The other two stimuli, right? Now, next coming to the anesthetic test. These are the tests which are actually carried at the later stages where none of the commonly used test is having an action. So what we do is like patient is having a pain over the entire area. So what we do is like we anesthetize a single tooth at a time. If the pain subsides, we will come to a conclusion that this was the tooth which was having the pain, right? Next is test cavity. Again, what we do is like without a local anesthesia, we will be cutting the tooth. We will be cutting the tooth and we will be going inside the tooth, drilling it. And if a patient feels pain, and we'll say that patient is having a vital tooth accordingly. So we'll be doing a tooth cutting without what? Giving an LA, right? Another important test is actually bite test. This is a special test where it is used. You can see in the image here, it is called as tooth sloth or frac finder. These are the two important instrument that is commercially used for finding out fractured teeth. What we does is like, we'll be applying the frac finder instrument between the teeth and we'll ask the patient to bite on that. So what happens is like, if the patient is having pain on biting, we'll be applying the pain, we'll be applying the pressure on the tooth. If the patient is having pain on biting, means that there is a periodontal problem, especially apical periodontitis, because pressure is felt on the lower part of the teeth. That means that there is apical periodontitis. When we apply the pressure, when we release it, the patient is having pain, means that indicate that cracked tooth. See that this is actually the tooth. Okay, if there is a crack here, what happens is that when patient bite, the crack will open and the pressure inside this will decrease. Right. When we remove the bite, it closes again. So the pressure build and the patient will feel pain. That is why on pressure, if there is pain, that is apical periodontitis. On or opening, the pressure subsides, or pain on release of the biting, it is called as cracked tooth. So with the help of these two instruments, we can find these two conditions. Very important. So that was all about the vascular supply. Till this PPT, this slide, we actually was dealing with the neural test. So our next portion is actually the pulpal blood flow or the vascular supply of the teeth is being assessed. There are two important methods, that is the invasive method and non-invasive method. Invasive method means we will be invasively applying the dye or the radioisotope into the tooth. Non-invasive means without destruction or without actually harming the tooth, we will be apply the methods, right? Just memorize the invasive method so that whatever comes in the other part, you can think as it is a non-invasive method. Invasive is like isotope clearance method. We'll be actually applying isotope in an invasive manner, and we'll be finding out whether it is actually vital or a non-vital tooth. And H2 gas desaturation method. Just memorize these two. Other all comes under the non-invasive technique. Very important one is laser Doppler flowmetry. So whenever you hear about laser Doppler flow means flow of the blood. So it is based on the vascularity. It is actually a vascular test. And what is the principle? So there we use, as a name suggests, laser. So we'll be using a laser. The laser will have a small fiber optic material. We'll be applying on the tooth surface. That should be, the gingiva is that the tooth consists of gingiva. It should be 2 to 3 mm just above the gingiva. We will be applying the laser. And what happens is like, the laser light inside the tooth, there will be RBCs moving like this. So when we apply the laser, it will hit, as the material move, it will hit the laser light. And this is being actually taken by a photo detector. As you can see in this image, see, with the help of lasers, we will be actually applying the laser light, and photo detector will be taking the information. And with the help of, this is based on actually laser Doppler flowmetry, is based on the Doppler principle. Okay, and Doppler shift back scattered light is interpreted by an index of pulpal blood flow. So that is actually the method how we actually calculate the number of signals that come out by a moving RBC. In a necrotic pulp, there will be no movement of the RBC. It will be stagnant like this. So whenever we apply a light, it will come out with the same intensity. So we can come to a conclusion that it is a necrotic pulp. But there is continuous movement of RBC, means it will have a different shift or Doppler shift in the light, which was actually applied to the tooth, and it will be actually taken by the detector. So that is a mechanism of laser Doppler flowmetry. Next is pulp oximetry. See, here is oxy means oxygen, so it is something related to the vascularity. So again, it is a vascular test. Never confuse this with a neuro test. Neuro test, there is only three things. What all? Thermal test and electrical pulp test. Thermal test consists of cold and also heat. Very simple. Pulp oximeter, what it does is like, it consists of, actually you can see in this image, two detector are there. You can see in the same principle, it will actually passing two sets of actually light, and there is a detector. RBC will reflect the light. If the RBC are flowing very good, the reflect like good uh, amount of concentration of the signals will be reaching on the detector. If it is stagnant or in the necrotic stage, none of the light will be actually coming to the other part. So it actually often is taken by different quantity. Oxygenated and deoxygenated hemoglobin absorb different level of red and infrared light. So based on that, this is how we detect actually the quantity of oxygenated and deoxygenated blood is actually calculated. This is a so you need to know it is a non-invasive method where the oxygen saturation level is actually done, and there is two transmitters on the upper part, red and also infrared light on the upper part, as you can see in this image, and on the other part there is a photo detector that is actually seen, right? So that was all about photo oximetry. So in the first laser Doppler flowmetry, it is based on the Doppler shift law. This is based on the Lambert law, Beer law, or the Lambert law. It's a combination of two law, Beer-Lambert law. It states that the amount of substance which is absorbed by a solution is determined by the intensity of light through the solution. Means whenever we apply a light through that, it have to pass through this. So that is a basic law. Just think that whenever we pass anything, it will absorb, it will actually throw it away. That is the same mechanism, because oxygenated and deoxygenated blood actually carry different level of actually the infrared and red lights. So this is the just mechanism. So just memorize the two laws. So the question is like, pulp oximetry is actually used in, what is it? Pulp oximetry, we know that it is used to indicate the blood flow. It is not the blood volume, not the blood coefficient, blood flow with the help of a laser. So the answer is like laser wavelength for estimation of blood flow. So that is the answer, right? Sorry, the answer is like probe with, it is not laser. Laser was in the first case, laser Doppler flowmeter. Here we use a probe with diode to measure the oxygen saturation. Very important. Laser wavelength for estimation of blood flow was laser Doppler flowmetry. Probe with diode to measure oxygen saturation. That is a term for pulp oximetry. Oxy means oxygen. That you need to memorize. Laser Doppler flowmetry means laser that I have showed the flow. Very important, right? Next is three important terms that you have to keep in mind. Dual wavelength spectrophotometry. This is also a method to actually, is a non-invasive method where we'll be assessing the oxygenation changes in the capillary blood, and it detect the oxygenated as well as actually deoxygenated blood again. Just these are the two important things that you have to keep in mind. Next is tooth surface temperature. Again, this is actually the method by which the surface temperature of the tooth is actually different in a vital and a non-vital tooth. Based on that range, they will be actually comparing the tooth surface temperature. There are four important methods, that is the thermocouple method, thermistors method, infrared thermography method, and cholesteric liquid crystals are there. So what is infrared thermography? As you can see in the above image, what we will do is like a small amount of temperature change is being actually detected in a computer controlled method. Computer will be actually assessing the change in actually temperature. So that is a method where we will be able to actually differentiate between the vital and non-vital teeth. That is the main thing, that it is a non-invasive method. It actually sees the vascular supply or this which in turn actually affect the temperature change on the tooth surface, and that has been actually taken by the computers. Next is photoplethysmography. That is also actually recording the pulsatile variation in the blood circulation again. So what happens is like when there is change in the blood flow and volume, because the tooth actually consists of enamel and dentine. So what happens is like as the blood supply decreases in our tooth, the tooth opacity also changes. That is because when our tooth is alive, there is continuous supply of nutrients, and the tooth is actually properly placed and all the calcium phosphate level is actually maintained, and there is opacity being actually maintained. So what happens when we actually, there is a necrosis, there is decrease in the blood, there is no proper supply of the calcium phosphate nutrition to the pulp, there is change in the opacity. So change in blood flow is calculated to the change in opacity, and that is recorded, and that is directly and indirectly being actually proportionated. last one is 133 xenon isotope. So 133 xenon isotope is actually used for measuring the pulp blood circulation, where we'll be actually injecting the micro labeled small radioisotope into the blood, and this is actually used to differentiate, and a probe will be actually used to differentiate the vital and also the non-vital teeth or the pulpless teeth based on the blood supply. Okay, these are the main important things that you need to actually study in diagnosis. So simply to simplify, it is what all the objective tests: pulp, periodontal, periapical. Pulp is of like heat test and cold test, very important. You need to know about heat test, cold test, electrical pulp test, laser doppler flowmetry, pulp oximetry. Pulp oximetry is oxygen saturation, laser doppler flowmetry is laser light for actually detecting the blood flow. Very important. Just read through this and do it properly. Thank you for hearing to my class. See you in the next class.